this is Dr. Michelson, and I understand that you just had a wisdom tooth or a tooth removed, and I just wanted to go over some post-op instructions with you. You may have just gotten home and noticed that anesthesia is wearing off, and there's a couple of things, some don'ts that I recommend that you don't do. One is I recommend you don't drink from a straw. I recommend that you don't smoke. I recommend that you don't spit. All of these three things cause negative pressure, and so we don't want the blood clot that's forming in your mouth to fall out. If you do feel like there's a lot of saliva or blood in your mouth, you can just lean over the sink and let it just fall out of your mouth. We just don't want you to swish. We also don't want you to use any alcohol mouth rinse or drink any alcohol, because that also can slow down the healing process. I also don't want you to do any heavy lifting. If your job requires heavy lifting, we would be more than happy to write you a doctor's note so you don't have to be doing that. No weightlifting or exercise for the next 48 hours. And also, it's very important that you don't eat any small particles like seeds or nuts or tortilla chips that might get caught in the socket, because those also can alter the healing time of the socket. A couple of things that I do recommend: if you notice a lot of bleeding in your mouth, I recommend warming a tea bag and having you bite on that, and that's going to instantly clot the socket. And a lot of times patients get a little nervous because they see a pool of blood, but a little bit of blood and a lot of saliva, it looks like a lot of blood. So don't be alarmed. It's mostly saliva. If you feel like it's a lot of blood, the tea bag trick works great. After about 3 days, if you're experiencing a lot of pain in the area, you might have developed a dry socket. Please call the office right away. If you follow all the instructions that I've given you, most likely you won't develop a dry socket. So I also recommend a soft diet for the next couple of days, and avoiding anything too hard or crunchy in the area where you've had the teeth removed, because we just want the tissue to be nice and healthy and close without infection. And please take all your recommended antibiotics and painkillers as needed, and don't hesitate to call us if you have any questions. We're here for you.